And we are going to record our session today so that we can send it out and share it with everybody on this call, but also those who can't make it. Hello, hello. Happy Thursday. If you're anywhere near Ann Arbor, it's sunshiny, which is amazing.
Rachel, would you mind bringing up the slides?
Yeah, I'll pull them up.
For the folks that are joining us, were you able to come to the intro to field education meeting that we had earlier? Good, good. So glad. Wonderful, good. So this will be just, some additional information about those hospital-based placements. And if that is what you're seeking today, you are in the right place.
And you should be able to see my screen.
Jessica, because I can see your face. Are you able to see it?
Yes, I can see it.
Wonderful, thank you. All right. Okay. Oh, why don't we go ahead and get started? We're at 5:01 right now. And I will kick us off. So, welcome everybody. This is the hospital-based placement meeting that are starting field all 2024. So if you're seeking more information about that, you are in the right place. We are so happy to have you. We are recording this session so folks can go back and take a look. If there's something you miss or just want to revisit something we said, you'll be able to do that. Can I get the next slide? Okay. So we're just going to briefly introduce ourselves and our wonderful team at OFE. I am Amy Brandt. I'm on this call because I have a lot of the aging pathway placements. And some of those are in Michigan Medicine, some of those are in the VA, and then there's some in some other areas in this region. This is, so the screen before that was we have some of our administrative folks, so you've probably seen their names come across your desk. Erin Kong is our new-ish director. She will have been with us for a year come fall when you're starting. And then this is our admin team, and Dr. Yatisha Robinson is our current assistant director of the online program. We're hiring for the residential program over the summer. And then the next slide is, this is our field faculty. So we are the folks that will grade you in field placement. You'll have site visits with us while you're in placement. You'll get to know us pretty well. So like I said, I work with some of the hospital-based placements. Amy Van Tyne and Rachel Naskow, who's on the call too. We are the folks that have most of the hospital-based placements. So that's why we are meeting with you today. All right. So I am sure you all can guess that there are so many ways that social workers play a part in the healthcare world. Just to kind of warm us up a little bit, when I am talking about social workers in healthcare, what pops in your mind? What kind of roles pop into your mind about places where social workers play a part? And if you want to speak, you're welcome to. You can unmute yourself, or if you'd like to just share something in the chat, that is also okay. Awesome. So Jessica says discharge planning, helping out in the ER, absolutely. Any other thoughts? coordinating with care and families, yes. Resource options, care planning while at the hospital, yes. Behavioral hospitalization, 100%. Yeah. Level of care transitions. Wonderful. You all are really thinking broadly here. I like that. Behavioral management during medical care, absolutely. Don't forget, there are also things tied to the lifespan. So maybe end of life care or helping out in areas like OBGYN and obstetrics. There are so many ways that social workers play a part in this particular area of social work. All right, so we put this at the top of the list for a reason. We want you to be informed about what would be required of you if you take on one of these health-based placements. One of the big things we will require of you is to take Social Work 714. That is an additional requirement. It will use some of your electives to take it. And it will be offered online on Wednesdays from 3 to 5, only winter term. But we will require you, if you have one of these placements, we require you to take this Social Work 714 course. The biggest thing you need to know about that is it is about interprofessional service learning. So you are going to work with folks that are in the med school, in pharmacy, in dentistry, nursing, and learn how to work on interdisciplinary teams. We think it's essential for your learning. We think it will help you be more effective in your placement. And we're really proud of this course. It's something we hope that if you do take it, that you add to your resume and talk about it in job interviews. It really is a fantastic, fantastic course. But we want to be really clear with you up front. It is a requirement. There is no wiggle room on that. You will have to take this course. Don't worry, it will not bore you. It's a fantastic course. But it is something we require, and we want to make that clear from the get-go.
Thank you, Amy. So I'm Amy Van Tine, and thank you to my colleagues who do what wonderful colleagues do and social workers do. I just had what was an emergency call, but just want to let my friends and colleagues know, only mini emergency, fortunately, just a little update on what was going on with my family member. So nothing terribly crisis oriented. So I'm able to be back. So, but thanks for pitching in to help me out if need be. So yes, as Amy shared, I have also many of the healthcare-based placements, and that's really my background. I spent my career really doing medical social work, and it's a big passion of mine. So I'm always excited when we have students that have an interest in this area. And I want to be able to highlight that sometimes people have an idea when they're talking about wanting to do medical social work or healthcare social work, they have a particular idea in their mind. And so I love that Professor Brandt really talked about what are your ideas of what medical social work is, because people have lots of different ideas about what that means. And so want to be able to kind of differentiate a couple of different areas of healthcare social work or medical social work. Two different areas that get highlighted quite a bit are between medical social work, more physical health care, and psychiatry, mental health care areas. Although healthcare is really there are lots of areas of healthcare that still have a lot of area of needed growth. There's one area that has really had a lot of benefit that's been happening, which is really a movement toward integrated healthcare, where medical and psychiatry are really more integrated than they once were. However, there are still some focused areas where social workers tend to have more focused areas between medical and psychiatry. And so want to be able to talk about those things. But as you look at these two boxes, you will see that in each of these categories, many of the items are the same. So if someone is in more of the physical medical side, you'll see that there's both inpatient and outpatient work that happens. That's in medical and in psychiatry. Interdisciplinary teamwork is in both areas. Clinical assessment, these are all areas where social workers are doing similar work, working within similar competencies. And so we talk about the competencies that social work students are building are transferable to lots of different areas. And that is very true within a healthcare setting. So in the medical side, people are going to be focusing a little bit more on adjustment to illness counseling, developing a lot of complex care support and advocacy, talking a lot about welfare and safety, planning for home care for patients. There's a lot of end-of-life grief and loss or adjustment to illness grief and loss, a lot of linkage to community resources and support, case management. So people talked about discharge planning and lots of other things as well. And in psychiatry, depending on if social work is in an inpatient setting or an outpatient setting, there may be some more individual sessions, there may be more family sessions, still some focus on vulnerable adult safety or child safety and welfare. There's grief and loss around new diagnoses, adjustment to new diagnoses, medications, those kinds of things. Again, linking to community resources, case management, and a lot more. So there are some differences between medical and psychiatry, but you will see there is a lot of overlap in terms of the skill building that happens in these areas. Next slide. So we will be talking a little bit more in depth about some of our larger healthcare placements, the organizations where we have the most placements available, but we definitely want to be able to highlight some of the other areas where we have some really, really fantastic healthcare placements as well. Some of these are more community-based healthcare placements. And so wanted to be able to highlight those a little bit. The Corner Health Center is a community-based health clinic, which is here in Washtenaw County and in the Ypsilanti area. And that is a place that does both behavioral health care as well as physical medical care as well. And they work with a wide range of ages. And it's been a great placement for students to be able to do, again, both some of the OBGYN, maternal health care, as well as behavioral health. Hope Clinic is another community-based health clinic where students have been able to do, again, case management, behavioral health, therapy, and patients are able to come in and get really comprehensive health care from mental health care therapy, physical health care, dentistry. There's a food bank there. It's really very inclusive care. So another really wonderful community-based healthcare placement. CNS Healthcare is another healthcare mostly focused on behavioral healthcare. There are many different locations where students have been able to have a lot of opportunity to learn about therapy and doing a lot of behavioral healthcare. And then we have two other larger health systems that we've been able to have students placed in as well. The Henry Ford Health System also has various locations. And there's a mix of some inpatient placements. There's a Henry Ford Kingswood Hospital is an inpatient psychiatric hospital where I've been able to have several students at a time usually, which are some really wonderful inpatient psychiatric placements. And then they have some outpatient placements as well. And Trinity Health, which was formerly St. Joseph Mercy Hospital in the Ann Arbor area, again, has some inpatient placements as well as outpatient. They also have merged with IHA, which is Integrated Health Association, where they have clinics kind of throughout all over Michigan now. So a lot of outpatient placement opportunities as well. So there are, sometimes people think about healthcare placements as only really large healthcare systems, or they think, well, I'm at U of M, so it's only Michigan Medicine. Michigan Medicine is an organization that we work with and have students placed, but we have opportunities in lots of different areas. So we will highlight a couple of others that we have most of our placements, but we definitely wanted to be able to mention these as well, because of really wonderful opportunities at some of these placements too. And I see that Amy Brandt did put in the chat here that we will have time for questions and answers at the end of this call. So absolutely, we'll make some time for that too. So next slide, please. So we'll talk about Michigan Medicine here briefly. Michigan Medicine is one of the placements that we do generally have a larger number of students. Of course, because they're part of the University of Michigan system, we do have a direct relationship with them. There are generally placements both on the medical side, as I was just talking about, as well as psychiatry. And I'll talk a little bit more specifically around how many placements we have available for the fall. One of the things that I always want to be able to talk about when people think about psychiatry is they think about inpatient psychiatry. A lot of times people think about that as being therapy in inpatient hospital therapy. And psychiatry on an inpatient unit is generally, social workers are generally not doing therapy. Inpatient psychiatry is a lot of discharge planning. There are oftentimes, it's a lot of crisis intervention kinds of things, but it's often very different than what people are anticipating about learning how to do therapy. So usually if that's what something people are interested in doing, it's usually wanting to emphasize having more opportunity to practice on an outpatient, in an outpatient environment. So again, it may not even be in a hospital setting. It may be more in a community setting. So wanting to emphasize inpatient psychiatry, whether that would be adult or pediatric, mostly on an inpatient unit, is not going to be practicing therapy. Still learning skills that are able to be transferable to working in doing therapy postgraduate. But during a field placement time, there's not practicing doing a 50-minute therapy session. Similarly, on the medical side, sometimes people will say, I feel like I want to do medical social work. I want to do therapy in the hospital, working with a medical team. Medical social workers, which is what my background has been, medical social workers are practicing a lot of clinical skills, but medical social workers are not practicing therapy at the bedside. There's a lot of supportive counseling that's happening. There may be a lot of pulling from different clinical modalities to be able to provide and do interventions with families, but it's not doing 50-minute therapy sessions. So I just want to be providing a lot of clarity around that. On the medical side, you can be doing both inpatient and outpatient, similarly in psychiatry, inpatient opportunities and outpatient opportunities. All right, next slide, please. There are also at Michigan Medicine opportunities for what are considered more macro placements, which are projects, often placements that are working either directly with medical teams or they're programs that work within the healthcare system. And some of these examples may be, we have listed here, programs with dentistry or with Silver Club. That's one of the geriatric programs at Michigan Medicine. Sometimes there's with administrative teams, like with the student program at Michigan Medicine or the Department of Psychiatry social work team. So sometimes there are management students that might be able to work with administrators at Michigan Medicine in more of a macro placement. So there are several macro spots available at Michigan Medicine as well. Some of the macro placements are also considered IP light. And so students who are interpersonal practice students may be able to still consider these macro placements for their primary placement at Michigan Medicine, where they can be participating in the other student program where they're able to really engage in the learning the interpersonal practice skills as part of that student program, still be able to engage in some interpersonal practice skills as part of their direct placement, and also be able to build some more specifically on some macro opportunities within that placement as well. So these are sometimes these opportunities that are they're more unique for students that really have interest in being able to practice on multi-levels, micro, macro, and meso, which we know are great opportunities for students, because actually social workers generally are practicing in all those levels all the time anyway. So these can be some really great opportunities as well. Students that are in these macro placements are part of the student program at Michigan Medicine, which I'll talk about in just a minute as well. Next slide. So I just wanted to really briefly highlight, because again, I know oftentimes students are really interested in where the placements are at Michigan Medicine. And so I just wanted to be able to share specifically. Michigan Medicine is going through a lot of changes. And so some of the areas that do not have as many placements as they often do. So for fall, the placements that are available, there are 4 placements in the adult medical hospital. there is one placement available that would be connected to adult inpatient psychiatry, and that is in the psychiatric emergency services. So that is not actually on their inpatient unit, but it is what is attached to the emergency room, but it's the psychiatric emergency room. So patients that are coming in acute crises, acute psychiatric crises, and there are decisions that are being made about, are they needing to be admitted to the psychiatry unit? Are they needing to be connected to community-based therapy? That is the one spot that is available for adult psychiatry. There's one pediatric inpatient psychiatry spot available for this fall. And then in outpatient adult psychiatry, there is one, it's a perinatal, adult perinatal. So I'm working with people who are in a perinatal period. So either those who are pregnant, who are hoping to be pregnant, or who are recently pregnant, who are receiving psychiatric care. So there's one adult outpatient placement for that, and one child adolescent psychiatry placement as well. There are 2 placements in geriatrics, and then there are 6 macro placements, some of which are those interpersonal practice light placements that I was talking about as well. When our application placement is open, you'll be able to see the descriptions of what those macro placements are, so that you can see which ones have the interpersonal practice light component to them, and see if those also might be of interest to you as you're completing your placement applications. There looks like a really quick question. Does adult include geriatric older adult on these slides? So sometimes the adult placements do include geriatric. It depends on the placement itself. Sometimes in the intensive care units, we've had geriatric scholars that have been able to be in those kinds of placements because those populations tend to have enough older adults that are hospitalized in those units. So sometimes that can be the case. So we could talk about that more specifically if that was an interest of a particular student. Is the pediatric medical zero referring to Mott Children's Hospital as well? Yes, Mott Children's Hospital does not have any medical placements. So I would like to be able to talk about Children's Hospital of Detroit, which I think will be coming up in just a minute too. Wasn't sure if Michigan Medicine and Mott were combined. Yes, Mott is part of Michigan Medicine. So unfortunately, Mott does not have any, aside from the one inpatient psychiatry, pediatric psychiatry placement. That is the only spot for Mott for the fall. Yes, unfortunately. All right, so, okay. I do want to talk about Michigan Medicine does provide a training program for students as well. And so all students, regardless of where they're placed, can be part of this program. It is required for all students that are in any of the placements outside of the macro placements. Some of the macro placements, it's a choice between the student and the student's field instructor about participating in the program. Although I generally would say it's a really good choice to participate in the program because you get some really great skills being part of this program. But this is 4 hours a week, which is part of the 24 hours that are required to be in a placement at Michigan Medicine. And within the student program, there are mentorships, which are smaller courses on some specific topics that are related to all social workers. And so you get more in-depth training and exposure to some areas that would be really relevant and transferable to all areas of social work in a healthcare system. There are also preceptorships where you have opportunity to connect with other social workers in other areas of the healthcare system to be able to have some exposure to other areas. So for those that might be interested in pediatrics or Mott Hospital, even though they don't have a placement there, they may offer some preceptorships so that you may be able to spend several days with a social worker in Mott to be able to learn what it's like to be a pediatric social worker. So there's potential for those kinds of things. They also offer clinical skills trainings where there's opportunity to really practice doing different kinds of biopsychosocial assessments, be able to practice with other students, learning how to be able to do different kinds of assessments with different kinds of patients. There are different simulations Breaking Bad News simulations with patients where you're working together with a medical student to be able to get some feedback on how do you share difficult news. They provide social justice grand rounds and their opportunities to be able to be a presenter for that as well. And then other sessions like All Women Are Leaders. So there's a really robust student program as part of the placements at Michigan Medicine as well. Michigan placement for interpersonal practice students or the placements for the older adult pathway and the welfare of children and families, they are required to be in placement 24 hours a week at Michigan Medicine, all 3 semesters. So that is an increased number of hours per week that students are required to be in placement at Michigan Medicine. That is true of a couple of the hospitals as well. Not all hospital or healthcare-based placements require this, but Michigan Medicine does have that requirement. Next slide. So this is a very busy slide to be able to say that the student program does have a set structure for how the program runs, either a Tuesday or a Thursday morning, depending on the semester. And so those 4 hours that I was saying as part of the student program is set prior to the semester. And what is important is for students to have those mornings reserved so that that's kind of protected time for you to be able to participate in those programs if you are a student at Michigan Medicine. So if you are placed there to, depending on which semester it is, to have either the Tuesday or Thursday morning kind of as that you have a placeholder to make sure that you're available for the student program during those days. There are occasionally some adjustments based on when speakers are available or certain sessions need to be held, but that information is shared by the program director there well in advance, but primarily those things are held on Tuesday or Thursday mornings, depending on the semester. So just always want to highlight those timeframes for students as well. Next slide. So the Michigan Medicine process for application. Applications for Michigan Medicine, those need to be in by May 31st. We need to have those turned in to Michigan Medicine the first week of June. They are going to be reviewing all of their applications and setting up their interviews to be able to have those conducted very early in June. And so that is a pretty firm deadline. Please make sure that you have your U of M email on your resume and all of your documents, because that's how they're going to be contacting you for an interview. And it's really important for you to be checking your email regularly. If they email you to set up an interview and you don't respond, they're just going to move forward with any other applications that they have. So it's really important to be checking your email regularly. Michigan Medicine will reach out to you directly to schedule an interview. And if you are to be offered a placement, they will communicate that to you directly as well. They will always copy us on that information also, but they will communicate that with you directly. If you are declined a placement after an interview, they will let us know that as well, and we will definitely be talking with you about next steps. It is not uncommon for students to interview and not get a placement, and it does not mean that a student didn't do well with their interview. Oftentimes students do well with their interviews, but because the placements are limited, they don't have enough spots for all the students. And so fortunately, we have other really great placements to be able to still offer to students. And so we will work with you. If the first placement doesn't work out, we will work with you to be able to find another placement where you're going to have another opportunity for really great learning experiences and opportunities. So we don't want for students to feel discouraged, although we know it's disappointing to not get a yes. We just want to reassure you that there are lots of great opportunities for good placements with really great learning. So aside from Michigan Medicine, the VA, and the Children's Hospital of Michigan, which we're going to talk about those other 2 placements, but if you were to need to move forward with another healthcare placement or any other placement, that the next interview processes would be the same as they are for all other placements. So Michigan Medicine, the VA, and Children's Hospital, a little bit different, but otherwise, all the other interview processes would be the same if you were to move on to another, a secondary choice. Next slide. So I do want to talk about Children's Hospital of Michigan a little bit, especially given that Mott Hospital, which and that's really my background. I worked at Mott for a really long time, so I can appreciate that there's an interest. I forget who that was, but that there's an interest in pediatric hospital, so I can appreciate that. So I do want to talk about Children's Hospital of Michigan because that is a freestanding children's hospital in Detroit. And it's been a really wonderful placement for many students. So if you have any interest in doing pediatric medical social work, this could be a great opportunity. They have inpatient, outpatient, medical, and behavioral health opportunities at this hospital. And it's a great opportunity to practice interdisciplinary, collaborative care. It's really great experiences. The way that they do interviews at Children's Hospital is kind of like they kind of tease around it being like a speed dating format. And so they don't tell me exactly what the placements are specifically. They give me a number of how many placements they're going to have. But they more so like to match students with field instructors there. And so they don't tell me we have an oncology, we have a trauma burn, we have an emergency room. They don't tell me the actual teams that they're going to have. What they do is they have a day where they have students come in for their interviews and they have the field instructors there doing the interviews, and they have the student interview with all of the potential field instructors. And then they have the student rank who they feel like they would be a good fit with, and they have the field instructors rank who they feel like they would be a good fit with the students, and then they kind of match them up. And it has been a really good system that has worked really well for them. And students, and I've now had students for 3 years that have worked within the system, and it has worked really well. I think that this is an area, if you have any interest in pediatric medical social work, this could be a really wonderful opportunity. They also, Children's Hospital does require 24 hours a week as well for their placements. And so students have found that to be a really beneficial investment of their elective hours for any additional hours that they need to be using. They feel like there's great learning there. They also, although they don't have as kind of a formal student program as Michigan Medicine, they do have a student kind of collaborative where they have some sessions where they do some additional teaching. They do offer preceptorships where students are able to spend time with other social workers in the hospital to get some exposure to other areas of the healthcare system. They do some interview preparation and things as students are getting ready for graduation. So it's not as a formal student program, but there are a lot of additional training opportunities that they have there as well. And I have a couple of testimonials from students that were also given. So we have those too. And I did not bring my glasses, but I would like to read them. So I'm going to read them off of my other screen here. So I labeled these as worth the drive because I've often had students say, I would really be interested, but it's such a long drive. And I can appreciate that. As a student myself, I had that same kind of length of drive to a field placement. Granted, it was a really long time ago, but I can appreciate that it is a long drive. I did it too. And I think I can appreciate that that's not always an option for everybody. And yet, if it is at all possible, and this is an area that you're really interested in, I think it's, again, a really great investment. So just want to share a couple of these testimonials from others. So my internship at Children's Hospital was easily the most enriching part of my graduate experience. I got to do so much hands-on work every day with a huge range of cases. There was never a dull day, and it was incredible to see how much I could grow in only 1 year. I also had incredible support from my supervisor, who was an extremely talented social worker and so dedicated to my education. The atmosphere was so fun and so supportive, definitely the ideal place to learn and grow. Now, as I've been in the field for a few years, I constantly think back to what I learned at Children's, and I'm so grateful I got to build my foundation there. That was from one student. Another student said interns at GPAM, which I'm forgetting now what that acronym stands for, but it's an outpatient setting. Get to spend a lot of time directly with patients and their families, assessing their unique needs and providing resources. This helps you to learn more about behavioral health and developmental needs. Additionally, you get to work with and learn from an interdisciplinary team, including psychologists, other social workers, physicians, and medical assistants. The social worker gives great feedback on notes, assessments, and resources along the way. I feel ready to go out on my own after all the experience at Children's Hospital of Michigan. Another bonus was the opportunity to take on a therapy case and shadow social workers in unique settings, transplant, emergency department, and school-based social work. These are all great social workers throughout Children's Hospital of Michigan. So those were two. And then I added this last one I just got on one more slide. It's a little lengthy, but I just feel like it was really, I had so many from students that sent them. Originally, I wanted nothing to do with an internship in Detroit. It was far away place and I didn't see myself working. And honestly, I worried about the traffic. However, even a week into my internship at Children's Hospital of Michigan, I was glad I made the decision to go there. I felt a part of the team immediately. I was greeted and welcomed with so much knowledge and joy. The staff there really know what they're doing and enjoy it. The internship not only strengthened my desire to be a social worker, it made me forget I was paying to be there. I was a part of the general pediatric clinic, but got to shadow many different clinics. This gave a broad spectrum of what hospital social workers like because I wasn't just locked into one location. They do classes and work with you, not just talk at you. It felt like part of the family, and I so needed that feeling through my graduate program. I learned how to talk to people, feel confident in myself, and how to work with a community I wasn't part of. Every time I had a question, people were there to answer graciously, and I never felt looked down on. They were encouraging, and I felt support and confidence every day, even the days I felt like I didn't know what I was doing. Interning at Children's Hospital of Michigan was probably my favorite part of graduate school. It was where I grew, where I learned, and frankly, where I found myself. I recommend this internship if you want to work with knowledgeable and outstanding social workers who take pride in teaching others. You're not just an intern here, but part of the family. Always remember the people, and I'm thankful for all the information they imparted on me. It was worth the drive, worth the chaos, because there will be some there, which is true in a healthcare setting, absolutely, and came out stronger for it. You'll learn multiple different aspects of social work and feel like part of the community. If you want to learn about hospital social work, you'll find a home here and expand your knowledge and be part of the team. So again, I think people can feel disappointed. I know when they're interested in Michigan medicine, pediatrics, but I just wanted to emphasize there are really great learning opportunities. It is a drive. If at all possible, it is worth the drive. So just wanted to emphasize that. And any questions, you can let me know for sure. All right, Rachel.
Hey, everybody. I'm so glad to be here. My name is Rachel Nosko, and I'm part of the field faculty team, and I'm here to talk a little bit about the VA placements. And as you're starting to probably figure this out, that there are a little bit of quirks about each organization that that we have field placements with, and so we're trying to help you with that. But as I listened to our training already, I was starting to think, if you haven't listened to our first webinar, it would be really helpful for you to do so after this. And it's up on our website. If you don't see it there, you can always email our office to ask for a recording in the slides, because we give a lot of foundational information there that leads directly into what we're talking about today. And that includes that we share placements with multiple schools. So if you're not from this area, there are several schools of social work within an hour's drive, and we are all trying to place our students in these same organizations. So we don't have a monopoly on Michigan medicine placements. We don't have a monopoly on the Children's Hospital placements or any other healthcare setting. They're pulling from schools that are local, but also online programs from across the country. So what we're doing is we're trying to give you the best information that we can help you move through this process with the best possible access. But just know, remember that our field instructors are volunteering to teach you. They don't get paid from us. We don't pay field instructors. They are welcoming you into their agencies because they love social work and they want to teach you about medical or hospital-based social work. So that was one point I wanted to make. And then the other one was about the 24-hour requirement. And Amy reminded you or suggested that there are hospital placements that require 24 hours all the way through. And I just wanted to clarify that if you are an advanced standing student, that even though you have fewer credits to accomplish, you still will have to meet that 24-hour requirement. And for those students who don't have advanced standing status, all of you will be moving to 24 hours in the subsequent second and third, or possibly fourth, actually it's only their second and third semester. So the first semester is the one where you're actually having to bump up, because you would normally start at 16. So I know that's kind of confusing. We talk more about that in the webinar, but I don't want you to think, well, any medical social work placement, I'm going to have to do all these extra hours. You all will at some point get to that 24-hour mark. It just depends on what status you come in at, where your placement is, and ultimately your schedule. And so I know that's probably more confusing than it is clarifying, but I want you to know we're also here to help you through this. So the reason we're having this conversation now is so that you can bring your questions to us as you're kind of working through the application process. And one of the things we say in the application process is that when you begin it, your number one placement that you select should be the one you want the most. You're going to be able to tell us 3. But if you want a medical placement, if you have a heart set on a Michigan Medicine placement, please put that as your number one choice, because then your application will go to the right field faculty so that we can move you forward in that process. If you if you put something else, but you really wanted a Michigan Medicine, or really wanted a VA, or really wanted to go to Children's, that won't be our first inclination. Our first inclination is to try to place you in your first choice placement. That's what we're going to try to do. So whatever the second and third one don't matter that much. It's really the first one that is then the most important. So if you want one of these placements in the application process, please put that as your number one choice. Okay. These are my notes as I've gone along. Okay, so let's talk about the VA. So the VA also has its own cycle. It takes students from all different locations and universities, and it does its own process, just like Michigan Medicine does. Unfortunately, their process is not aligned with our timeline. So if you are, and I also recognize that some students on this call may not be planning to start field in the fall, but may have joined knowing they were going to start field in the winter. So if you're planning to start field in the fall, this whole presentation was kind of geared towards thinking about you. We will do this again for those students who are going to be placing or starting their field placement in January. We'll do this again in the fall, and the information will be slightly different because Michigan Medicine will generally have more placements available. Is that true, Amy Vantine? Is that also true for Children's Hospital as well?
Not necessarily for Children's, but
Okay.
for Michigan Medicine, they do generally have more in the winter term.
Okay, because that's true with the VA too. So, so if you are applying for the VA specifically, if you're starting field in the fall and you really want to go to the VA, we need to help you get the application open today, or tomorrow, or as soon as possible, because they are already in their process and they are only offering about 6 placements across the entire Ann Arbor VA, which includes Flint and Detroit. So if you're in that boat, I would love you to email me or reach out to me directly. My email is actually on this slide, rtmackey@umich.edu, and the field office, so that we can get your application open right away, and you will choose from the availability that you see on our placing dashboard. Let's see. So if you are interested in a winter 2025 start, we will be placing those students probably in August. And so we're going to be reaching out to you again earlier than the typical placing process, because that's how the VA works. And there'll also be placements in Detroit, the Detroit VA, which Amy Brandt manages for the winter start. In hospitals, for some reason, they like to start in January. That's one of their, they like that timeline. There's something about that cycle. So there tend to be more placements available for students who are starting field in January. In general, those would be the 16-month students. But there are certainly plenty of placements that are available for the fall as well. VA also has a training program, but I would say not as organized or formal as the Michigan Medicine Training Program. They usually have once a month activities that are usually virtual, but they also offer preceptorships where you can go to other meet with other social workers in areas of interest and spend time with them to learn more about their role. The other thing I'll say is because the VA is such a large system, they take the reason that we're like not in sync with them is they want you to be placed much earlier because their process is just very slow and a little bit arduous. And so there will be paperwork, and we're going to talk a little bit about this later, but with the VA, there's actually paperwork that I have to review and our director has to sign before we can confirm your final placement. And it's usually around your health requirements that we're going to talk about in a little bit. So mostly my point today is there are placements for fall available. If you're interested, reach out to me right away and we'll get that process started for you. If you're interested in a winter start, you should be reaching out to me in probably early August to be able to talk about what the availability will be for winter. And I think that is it. The VA does not always require 24 hours all the way through like Michigan Medicine does. They generally will follow your typical schedule depending on whatever your course plan suggests. Okay. So we talked a little bit about these hours and credits. Mostly what we want you to know is that there will be some placements that require that 24 hours, and you'll see that in the placement description. There's actually going to be a little button where you're going to say, yes, I understand that this placement requires some different field schedule when you apply. But we will also be guiding you, field faculty, as we're reviewing your applications and help connecting you to the agencies. We're following you through that whole process. And then we remain your liaison once you're in the field placement itself. So we'll be sending you emails and communication about, okay, your next step is to register for field, and this is what this looks like. Or you need to fill out this form, or whatever the things are. You'll be getting emails from us to prompt you along the way. We're really just trying to bring it to your attention because timeliness in the application process for all hospital-based placements and really for all placements is super important. We have a small amount of time to place many, many students, and we want to get you there as fast as possible. You want to be placed as much as we want to place you. So we're trying to give you more information so that you know what to be expecting. And let's see. Right, we'll give you more information. If you end up landing in a hospital-based placement, we'll send you an email that confirms, yes, you are going to be in this particular field placement with this particular field instructor. I will be your liaison, and here's your next steps, depending on what we know of the agency requirements. And if you ever have questions about that, you should always be communicating back to us via email, where we try really hard to respond as soon as possible. I mentioned earlier about special requirements. So it probably doesn't surprise you that if you're in a healthcare system, there are certain requirements that come along with being in that environment that you'll have to complete in order to accept the placement or finalize the placement. That often has to do with immunizations, or TB tests, things like tetanus, drug screens, and background checks. Some organizations you're going to get the placement and they're going to start doing that with you and giving you cues and sending you emails, and they'll take care of it all in-house. Some organizations like the VA do not. So they'll give you the form and they'll say, okay, now you need to submit all these forms, but you'll actually need to collect that information yourself from your doctor, or get your TB test, or update your immunizations or vaccines. So, again, we want you to be aware of it. We will help to guide you along the way. But if you know you want to be in a hospital-based placement, it might make sense for you to start collecting some of that information right now, because you probably will have to submit it. Amy, Michigan Medicine requires it, or they do it all in-house themselves?
They require those things, but they facilitate getting those things.
Okay.
Yeah.
Yeah, so that's like a good example.
But many don't, and it is important to follow very timely communication, because students have had very late starts to their placements because they did not follow through on getting these things accomplished, and they've started many weeks late because they didn't have these things set up at the time that their placements were to start. So it's really important to get on these things immediately once you have your placement confirmed.
And we will hold a both and, right? So yes, you can start your placement late, and yes, you're still going to have to complete the same amount of hours. So that's why we're kind of nudging you along. We understand when you're an incoming student, you don't always know like what is the highest priority? How do I juggle all the things that are coming at me? This is a high priority. Getting your placement information together, making sure you're turning things in a timely manner. This is high priority because it actually impacts the organizations, and we can't always undo it, right? If an organization says they didn't answer their emails or they didn't respond, I'm going to go ahead and give this placement to somebody else. I can't undo that. So we're trying to protect you from having that situation happen, because we also know this is happening before you come into the program, right? So you're not all totally oriented, but we're asking things of you early on. So please look at your email and try to be as responsive as possible so that you don't miss out on an opportunity that you really are excited about. If you have problems with getting any of this information, please reach out to us. We may be able to connect you with resources that would help facilitate that process, but we won't know that you're struggling unless you don't tell us. So please reach out and let us know if you're coming up against a barrier with any of the specific requirements for a field placement within a hospital-based setting. Okay, oopsie. Here's some reminders. So please do not write about your health history. We'll ask you about why you're interested in interpersonal practice or why you're interested in the pathway that you're going to be selecting, because your pathway will be connected to your field placement. They have to fit together. And we're going to ask you about that. And we understand that many people bring experiences that have kind of compelled them to join our profession, whether they were positive experiences or not positive experiences, or even experiences that they're currently going through. We ask that you keep your health history out of your goal statements, because we want you to start to develop your professional identity. And in most cases, you won't be talking about your own healthcare challenges with clients or patients, or really with the organization that you're working with, unless you need additional support. So if you have a current health issue that you need accommodations for, please reach out to us. We'd love to hear from you and support you. There's resources on campus to help facilitate that, but we just don't want it in your goal statement specifically. There'll also be a little spot on the application where you're going to be able to type to us any kind of message you want to say, like, oh, I really want to do this work because X, Y, or Z, or I have a sleep disorder and I'm working on getting my documentation so I can get my accommodations. Whatever it is, you can tell us all kinds of things, but you don't want to put that in the goal statement, because your resume and your goal statement are the two things that actually will go to the field site. They won't see all your application information that you're showing us. That only comes to the field office, but your resume and your goal statement will go directly to the agency itself. So you want to make sure that that reflects the professional that you are becoming. Follow our directions explicitly, and don't be afraid to talk about what skills you're interested in learning. We talked about some of those today, even on our slides, like case management or discharge planning or resource identification. We want to hear about that. We want to hear about what your ideas are. Sometimes that's how we know that you might be unclear about what an opportunity offers, is if you talk about one thing, but we know that the placement doesn't really offer those things. And if that happens, we'll reach out to you and say, hey, can we talk about what you wrote and what you're hoping for? And maybe we can help you find a better fit. So we will review your materials before they go to agencies to just make sure that they look the way that we have prescribed to you, but also that you're not making any missteps along the way. Write about why behavioral health for psychiatry, right? And what is your interest? Is it, I'm interested in learning new interventions. I'm interested in working with children or adults and with psychiatric illness. Talk a little bit about the the why and what that might look like for you. Please do not reach out, and this goes for all placements, please don't reach out to placements directly about your field application or a potential opportunity. If you have an idea, come to us. We'd be happy to talk with you. We may even already have an affiliation agreement with that organization, but most of our major hospital systems know that the applications are going to come from us. They shouldn't come from you directly. And so they will redirect you back to the field office. And it can send off signals to our sites that the student is not reading the information, is not following the process, and that might indicate future problems down the road. And you don't want that. Again, it's like making a misstep when you don't know that you're even making it. So please don't reach out to agencies or placements directly. You're welcome to reach out to us. We're happy to talk to you about them, share all the secrets, pull behind the curtain as much as we possibly can. But do not reach out to agencies directly. If you're interested in opening a specific field site, let's say you have an idea, but you don't see it on the application when you're looking at the application, please reach out to us again. We are happy to explore new agency options. We're always interested in developing new relationships. And so if you don't see it, please contact us and we're happy to look into it. It can take several months to be able to establish a placement. So if you have an idea, let's say in May, and you're in your application and you're not seeing it pop up, reach out to us right away. Because if we think this is really what you want to do, then it might take some time to get all the paperwork together. It's an actual legal agreement between us and an organization. And so it goes through many parts of the university and the organization before we can actually allow you to be there as a student. Hospital placements are not guaranteed and no placement is guaranteed. There are so many factors that impact the placing process. Things like more students that are interested than opportunities available. So let's say there's 2 outpatient psychiatry placements at Michigan Medicine. I'm making this up. But there are 8 students who are interested, right? They're not going to create more spots. There's going to be 2 spots, but then 6 people will not have that placement. And so that's why the other choices on your list are important. However, while we're going through that, you'll only be interviewing with one organization at a time. And while you're going through that process, your number 2 slot is often somebody else's number 1 spot. And so if you don't land in that very first option, and we go back to your list and review it, the second slot may no longer be available because somebody else chose that as their first slot. But that is the field faculty's job. Our job is to get to know what your interests are, help identify next steps and placements. We have a weekly placing meeting where all the people who are doing placing come together and we talk through individual student needs and how do we connect them to the right placements. And there are lots of ways and places that you can learn about the skills that are connected to hospital-based social work, even if you're not in a particular hospital with what you might think of as the dream placement. That is also our job, is to help you understand what the transferable skills from one opportunity to another. Social work is a very broad generalist degree, right? If we think about the application for social work, it is we see social workers in lots of different places. And I would also, I've been lately making this analogy to nursing, right? So you see nurses in all kinds of different places, right? ERs, in hospital units, in outpatient settings. And is it always the same? Does their practice always look exactly the same? No, but they are still doing that. They are still practicing nursing skills. Same for social work, right? We see social workers in private practices, in hospitals, in schools, in community-based agencies. Are they all practicing the same kind of social work or the exact same contextual practice? No, but they're using social work skills, right? And that is what our program is about. And that's what every MSW program is about across the country. One MSW from, let's just say that school down south, like, OSU, their MSW degree, right, is the same as your MSW degree. It's a beautiful degree and it allows you to go from one place, one context of practice to another. This is the same. So if for some reason you don't land in a hospital placement and that we thought was your big dream, our role is to help you figure out how do we get those, how do we name what those skills are, and then find other opportunities that might help you mimic that practice. I think, I don't remember how many years, Amy Brandt, I think you said we have 150 years of experience on our team. Is that what you said? Okay, 150 years of practice experience just in the field faculty team alone. There is a lot of practice experience. So use us. That's what we're here for. That's literally the job that they pay us to do. Right. Now we are going to open it up for some questions at 6 o'clock. So I know that we only had you until 6 o'clock. So we thank you for coming. We're going to hang tight, or at least I can hang tight. Amy and Amy, can you hang tight for a few minutes too? We'll stay
Yes.
back and answer some questions. And also don't forget that we will have placing office hours coming up soon. I think they start next week, don't they?
I think so.
I think they do. Where you can drop in and ask questions and leave all throughout the week and all through the placing cycle. So if you need to jump off now, that's okay. You can come to one of our placing office hours, or you can always call the office and ask the specific question. But I want to say thank you and open it up for questions. And if you probably could raise your hand, that way we would know what order to take you in. That would be good. Okay,
And I wonder,
Danielle.
can we take the slides down too?
Sure, yes.
Awesome.
Yes.
Great. All right, and I'm seeing a few questions. Why don't we do one person's in? We'll do Danielle, then we'll do one from the chat. We'll go back and forth.
Okay.
Looks like Danielle first.
Hi, yes. Okay, I have a question. I'm still deciding if I want kind of like a medical field placement or not. I'm definitely looking for a more clinical setting with like therapy experience. And I was just wondering, is there a list somewhere of like every single placement available in the fall? Or is it kind of separated by category?
Nope, it's field. That's going to be in the field placement application that opens up next week.
Awesome. Thank you. Just to kind of keep track of all the different options. Thank you.
Yeah, absolutely. All right, then we'll go to the chat. So does the University of Michigan offer the Forensic Psychiatry Center of Michigan as a placement option? So the Forensic Psychiatry Center, there's that is not part of Michigan Medicine, but Center for Forensic Psychiatry, if that's what you're referring to, I'm thinking that that's what you're referring to, is a placement that we have, and they do have a spot available for the fall. There is only one spot available at the Center for Forensic Psychiatry for the fall, but it is not part of the Michigan Medicine program. Okay, Allison.
Okay, so I appreciate that Danielle asked exactly what I was thinking about. I just want to clarify the list. We have to physically get it, or is that going to be sent through an email?
No, it's a part of the application. So it would be helpful. Were you, Allison, at the webinar?
Yeah, I've actually also already emailed you, so yes.
Okay, so it's in the application itself. So the application is electronic, and it's like a fillable form. So when you go into it, you're going to tell us all kinds of stuff about yourself. And then you're going to get to a place where you can start to search the placements. And there's lots of different ways you can search. Like you can search for paid placements only. You can search by areas of interest, right? Practice area, your pathway. There's lots of different ways that you can search.
Okay.
What I would say is that the best bet to get the widest range is to keep your search as broad as possible. So if you are an advanced standing IP student, I would only mark those 2 qualifiers and then leave everything else blank and see what comes up. And then start to get more specific as you go through, because the way the system goes is if you start putting in a bunch of different qualifiers, it's going to pull them, but it may leave out others that you might be interested in. So I say start wide and then go back and narrow down a little bit so that you're maximizing the function, the search function in the database. We have like over, I don't know, like 1,500 different affiliations with organizations. It's a huge amount. But it changes by every placing cycle changes what the agencies are offering, right? So a good example is the Forensic Psychiatry Center. I don't know if they're going to have an opening in the fall or not, right? And
They
right
do. Yeah,
now
they do. It's my, it's
Okay.
my placement. They have one.
Okay, great. So they have one opening, right? So when you go into search, what you're seeing is our best guess at what is open for fall. That's what you're looking at. And that could also change from the agency side, right? So that I might say, Allison, you might email me and be like, oh, I really want this, Rachel. And I'm like, great, let's do it. And I send your stuff over. And then the field instructor emails me back and is like, oh, you know what? I just found out that I'm taking on this extra responsibility at work. And so I can't take a student anymore. Sorry, I didn't let you know, right? So then I would have to come back to you and say, oh, Allison, guess what? That placement is no longer open. And I would close it in the database, right? And then we could go to your number 2, or we'd have another conversation. But we can't control what's happening on the agency side, right? We're just asking them, every semester, like, do you want a student? Do you want a student? Do you want a student? And they say yes or no, and then how many. But that can change at any moment in time. So that's what I mean by the placing process is dynamic. It's not like a job interview where they said it's available and it's going to be available, right? No, it's available as far as they knew at the time when they told us that they wanted to have a student, and there could be somebody's cousin's aunt's neighbor is also getting an MSW, and now they're going to be their field site, and so now our student misses out, right? So you really have to a little bit, you're going to hate this phrase, but like trust the process a little bit, because we're going to try to control as many things as we can, but there's a lot of variables that are kind of out of our control, not because we don't want to, but because it's an external agency that we're working.
So don't get your hopes up when you were choosing 1, 2, 3, and 4 options.
Yes. Oh, I mean, yeah, it's 1, 2, 3. Yes, but I wouldn't get attached to any one
Yes.
particular placement. Yes, that's great advice.
Okay, that's good to know. I won't. Okay, thank you. Thanks for listening.
Looks like the next question, Clarissa, do you know if any hospital placement sites focus on advancement of diversity, equity, and inclusion? Students within DEI special program have a requirement to find a placement focused on that. I don't have any that are specific to that. I don't know if anybody else does.
I don't, but you know what I would say is that one of those IP light
Right.
macro placements would be great for that,
Right.
because especially in Michigan Medicine, you would have the opportunity to maybe submit for social justice grand rounds. So you could do a little bit deeper dive there. Or if you were in a placement, Amy, you probably know this the best, but even in your interview, you could be talking about like your interest in advancing diversity, equity, inclusion, and how it might connect to the work. What I normally, and Amy, you tell me what you think. Normally field instructors want you to be able to do the things you want to do, but they also have things that they have to show you and teach you, right? So
Right.
sometimes there's some flexibility once you've kind of gotten into the role to explore these like branches that kind of come off on in ideas, right? And sometimes you don't even know what those ideas are until you get there, and then you're like, oh, that's really cool. I want to be able to do more of that. And then you would have a conversation with your field instructor, and then they would help you decide, like, is this really in the best interest of your learning? Can I help you facilitate this? Does this make sense? And you could also be having conversations with your field faculty, that's all of us, about those and how to navigate those conversations. So I don't know of anyone, but I bet we could make an argument with some of them.
Yeah, that's exactly what I was thinking. There's not one that specifically, like with the DE&I program specifically was what I was saying, like at the DE&I program at Michigan Medicine. But I completely agree that in any of those macro placements, there's very likely opportunity to have a focus project or just focus of the whole placement on some work within that area. So I think it could be an option. It's definitely something to be able to talk through a little bit in more depth for sure. Okay, doesn't look like anybody else has a hand raised, so I'll go to the next question on the chat. Also have a note that a field application for fall opens May 20th, closes May 31st. Has it been moved up?
Only for people who are applying to the VA. That's because I need to send them right now, like ASAP, you
Yes.
can get your stuff together and send them. And then if for some reason we get them and we send them and those placements are not available, then we'll talk about next steps, but I'm thinking about just letting you restart the application again. Because I'm worried about our timeliness and like getting you in there. So, only for the VA is it open earlier.
There's also, Sophie, thank you for direct messaging me about some links that aren't working on our incoming field student page. I will send that to our admin team to follow up on. Thanks for that message. Looks like,
Is it I'm wondering if it's the application itself.
I don't know.
Okay, I'll look.
Okay, it looks like Amy, you replied to something. Oh, Amy, you're replying to something. Awesome. Where can we find the field advisor office hours for next week?
I was just gonna put the slides in the chat. I'm gonna
great.
download them in a PDF so everybody can have them.
Thank you for that. I was trying to find it. I just couldn't find it.
Nope, I got it.
And then how many palliative care placements tend to be available? Well, so in the hospital placements, don't have any specific palliative care placements right now. Palliative care tends to be a consult service that many other placements get to work with, though. So what I would say is with some of those adult placements, the medical placements, I would say there would be likely to be some work with palliative care, but they don't have a student placement on that team at Michigan Medicine. I don't know if there are any hospice placements open for the fall. Amy, do you tend to have those placements?
I do. So if it is your dream to do hospice, please email me. I'm putting my email in the chat right now. I've got one site that that is in Livonia that is True Blue Hospice, and they currently have 2 interns, which is a lot for them, but I think one of them is graduating, so I might be able to find some room there in the fall, but it'll likely be like 1 placement. There's also a hospice site in Flint, and there's one on the west side of the state, which probably would be far too far for most of you. But I'm open to talking about these things and exploring some options. We do have another site that's open that just hasn't taken a student in a long time. So I'm also happy to reach out to them and shake some trees, see if I can find some space for folks. So again, if hospice is your dream, email me. Let's have a conversation about it.
And I would just say that anywhere in a hospital that offers preceptorships, that there would be an opportunity for you to probably spend time within a palliative care team to be able to have some more of that direct exposure. Palliative care is not only end of life care, it's really around quality of life planning. And so there could be opportunity to be able to have time with a palliative care team in lots of different settings and lots of different ways through preceptorships too, even if it's not a specific placement with them too. So there could definitely be some opportunity. Yeah. Any other questions?
I put the slides in the chat, and in the slides, there are all the due dates for typical applications, as well as the dates for our office hours, along with the Zoom link that you'll use. It's the same Zoom link for every session. And you're welcome to come into as many as your heart desires.
Thank you for putting that in there. Any other questions?
Ben?
Yeah.
Sorry, I'm like looking on the chat function here. Normally I see the raised hand thing and I can't find it at the moment. So sorry about that.
Well, no, it's okay to physically raise your hand too. That works.
Okay. So, Amy, I know I asked you this in our meeting the other day, but now that I sat through this presentation, I'm going to ask this question in a different way, if that's all right. And that is, so I'm part of the Detroit Scholars Program, but I just have so many interests coming into this program that it's like difficult to like pin down one specific thing. And I want to keep an open mind as I enter in the program and not just have like a predetermined, like my year of study should look like this. But considering like Children's Hospital of Michigan is in Detroit, I wanted to know if there is any opportunity for like an overlap in terms of listing my like top 3 placements. Because at the moment, I don't know what my options are going to be with the Detroit Scholars Program, just in terms of like what agencies are going to be available. But I am interested in like, I don't want to entirely close off the possibility of working in a hospital setting. And that particular placement sounds awesome. I know it's highly competitive, but is there an opportunity where I could list that in my top 3, or like, it's like if you're in the Detroit Scholars Program, it's excluding any medical based placements. I know, Amy, you sort of like answered this, but now that I wanted to see what this whole presentation entailed. And so, yeah, that's my question.
Yeah, I feel like, I don't know, Rachel or Amy, are you able to, I don't know, when it comes to some of the scholarship things, I'm not as knowledgeable. Do you know, either of you, for the Detroit Scholars Program, would Children's Hospital be a placement that can fall under a scholarship like that?
I'm almost positive because I think you just have to be placed in Detroit.
Yeah.
I think that's it.
Okay.
I think we'd probably just want to talk to Rosalva about it, right? But it seems like there'd be some wiggle room there.
Okay.
Well, I don't even know if it's wiggle room because I think it's just
Yeah.
what the requirement is.
Okay.
I think it just is.
Right.
I think you have to have a Detroit placement. Period.
And underserved populations probably too.
Mm-hmm.
Yeah. Mhm.
Great. Thank you.
That was easy.
That was easy.
Yeah. And I would say Children's Hospital can be a highly competitive placement, but in the 3 years that I've been here, they've generally actually had more spots available than students to fill them, which is different than Michigan Medicine. And it's really been, which you may have sensed, I'm pushing hey, it's worth the drive. And it's because students, have not, understandably so. It is a little bit of a hike, but that's why I'm trying to like share that excitement of what the possibilities are. So I don't want to, again, set expectations that, oh, there are more spots than there are students, but that's historically been the case. So I don't want to be discouraging of people around thinking that there aren't going to be spots at Children's. Historically, there have been more spots for students there. So yeah, Jessica.
So I think one of the biggest barriers for me for like fully committing to wanting to go for a hospital placement is the hour requirements. Can you kind of just talk about like some different ways that you tend to work with students to kind of help meet those hours, especially if we work through school as well?
Mm-hmm.
Yeah, I was going to ask, what do you think the barriers are?
I think it's just trying to find times that fit with your class schedule and then finding an internship schedule and also having to work with your employment. And then like me, I'm in Metro Detroit, so Ann Arbor is like a 40-minute drive. So there's also just the time travel for the
Yeah.
Yeah.
So I guess I'll say first and see what my colleagues say. The hours are the hours. Every student has to do 912 hours. Are you in the part-time program?
I'm in the full-time advanced standing.
Okay. So one recommendation I would say is to try to find a placement that's not at Michigan Medicine, or Children's also, I guess, requires the 24 hours.
They do.
Because you, as an advanced standing student, only have to do 16 hours a week. So that would be my first, like, if you're asking how to make it happen, I would say don't take on more than you need to. And then my second strategy, most field placements are going to be understanding about the class schedule because they, you're working with social workers who also had to go through this process. So they know, right? You don't get to pick when your classes are, you just have to go when they have. But we tell you when you're scheduling to hold 2 days because most field placements are happening between the hours of 8 and 5. There are some placements that happen after 5 or later, but they are few and far between. So I guess I would say for somebody who's trying to work, scheduling work after 5 or on the weekends has usually been the most effective way to do it, to really protect that 8 to 5 time, and then try to schedule work on the weekends and then those after hours. Amy, do you have any other recommendations?
I do. So Jessica, also, like, what could we do to help you mitigate the commute time? Like, we could very easily think about trying to find placements close to where you live to help you, get time back that way. So where do you live, Jessica, if you don't mind me asking?
I live in Westland.
Okay.
I think there are CNS placements in Westland.
Yeah. I mean, we might just want to try to find you something that's more local to you. And if you're already in the burbs of Detroit, I mean, there's a lot of students that don't want to make that commute. So if you ranked one of those as your number one, I think, that would be good.
I would say students who are willing to be outside of Ann Arbor have a better likelihood than students who are insisting on being in Ann Arbor. And sometimes that's because they don't have transportation, right? So in some ways, you being away from campus is actually an advantage because your commute to Detroit would be shorter, or, even in Livonia or Westland or Canton, all those spaces are so much closer that you wouldn't even have to come all the way to Ann Arbor if time is the thing.
That was really good. Thank you.
Okay.
Yeah.
Anything else?
Any final questions?
All right.
Well, thanks everybody for joining us today. This is a really lively session and I appreciate it. We are here to support you as you go through this process. And, like Rachel said, we have lots of experience under our belts. We're happy to use that to support you. Feel free to email us. I think you have all of our emails at this point. And also just another shout out to those office hours. If you want to just run your ranking by some field faculty and kind of talk that through together, that's why we have these office hours. So please join us. We're happy to help you troubleshoot.
And Allison, I saw your email.
Okay, thank you. And did I miss something about the office hours? I will not be a pain. You will not see me regularly. It's just nice. It's like a needed blanket that I have it, but I don't have to use it unless I have to use it.
No, I did. I just said I put all the slides from the webinar in the chat, and all the dates and times for the office hours, and the Zoom link is in that PDF. So if you were on the call, then if you scroll up just a few lines, I think it's 6 messages up.
Okay.
It'll be right there if you need another reminder of when those are. We try to keep them pretty consistent week to week.
Okay.
And then if that doesn't work, you also can just email us and we'll set something up. We just try to carve out time because our schedule, we're also not just placing, we're also liaisoning the students who are currently in field. So we're not just sitting at our computers all the time. We're kind of out and about in the community.
I don't even know how you guys do it. Don't even tell me. I just have 2 other really quick questions.
Sure.
One are a statement. This isn't negative. I'm just making a statement. It's really disappointing to know that there's so few placements. I had in my mind that there were like 80 placements in the hospital and the VA. And when I saw the numbers, I'm like, oh, someone left a number off. That's so cute. But apparently it's true.
Yeah.
So
Yeah.
there's that. So I really appreciated that other student, Danielle, I think her name was, that there is a list of other locations as well. I'm older, so I kind of know what I want, and I less time to flounder. So I'm like, this is what I want to do, exists time. So that's one thing. The other, that's my comment. Thanks for listening. The other thing is, I'm going through the master's track. So that allows me to then be full-time boots on the ground starting in the fall with 3 semesters.
You got it. Yep.
It's there. I'm not trying to be what I'm not, but that's not equivalent to advanced placement. So there's not a checkbox. Okay. I just was wondering if there was a air quotes advantage to being a master track. Okay.
No,
Okay.
you're what the advantage was that you did 1 semester of coursework
Yes.
Uh,
Yes.
online. That was it. And so now you're gonna, for as far as field goes, your schedule is the same. You're gonna have, you're required to do 2 credits of 515, which is 16
Mhm.
hours a week, and
Mhm.
then move to that 24 and 24 for your remaining 2. So you're really doing the same field schedule as most of the students in the program.
Okay.
It's the
All right.
practice part,
But-
and it's the part that's required by the Council for Social Work Education. Sorry.
Oh
Amy,
yeah,
go
no,
ahead.
I don't want to skimp on the field placement. That was what it was. That's not what I was trying to say. I just remember
Oh,
that.
I know.
Oh, okay, good. Yeah, I blinked for a minute and I'm like, wait, is there something about the master track people too? That
No,
was
no.
all.
And
Okay.
Allison, I'd love to just add just another thought to that too, is because I can appreciate the numbers being disappointing. I mean, I was disappointed too to get some of the numbers, was hoping that they'd be a little bit bigger too. Sometimes when students don't get into the placements that they want, the beauty of that is that people like me, Rachel, and Amy, because we've worked with other students and other placements, we know about the great opportunities and placements that students may not generally
Consider.
think about
Yeah, yeah,
because they're not as well known.
yeah.
And
I'm
yet
all about
sometimes,
that.
yeah, sometimes those are the placements that we know students actually have the most unbelievable opportunities in. And so I think sometimes, the ways that
really
students
appreciate
can
you
come
saying
back
that.
and say like, wow, I would never have guessed that I'd be able to, have this experience. So I think sometimes, what is initially a disappointment really can feel like an amazing opportunity too. So
I
at
appreciate
least
you saying
always
that.
hopeful of that.
I do believe in, okay, that one door opening or the universe trying to be wishy-washy, but I do believe in that very much. So I just wanted to make the comment that, oh, shucks darn, it would have been
Yeah,
good. Yeah,
for sure.
I'm sure there's something else on the horizon. That's why I'm like, where's the link? But I still want to try. So
Yeah.
I do believe in that. I'm not
Yes.
Yeah.
crushed. It's just like, oh, okay. So with that, I'm gonna stop sucking up air and I'm gonna keep doing my master's track because I have 2 more months to finish.
You got this.
I'll just see you in
You
person.
got this, Allison.
And we're glad you're going to try too, because you should try. Why not? Everybody should try.
Yes. All right.
Good to
Have a
see you.
good rest of the evening
Good
and the
night.
rest of the week. Bye, everyone.
Bye-bye.
Thank you. Bye.
All right.
All right.
All right, friends.